I reviewed Mr. Jason's case today. He reports to the clinic with complaints of dark-colored urine and yellowing of his skin over the past 3 days. He also reports mild fatigue and intermittent episodes of dizziness. He denies any fever, weight loss, or recent illness, but mentions that he had a stomach bug 2 weeks ago that resolved on its own. He recalls that he has experienced similar symptoms a few years ago, but never sought medical attention. His symptoms tend to worsen when he is under stress after taking certain medications. His father has a history of jaundice episodes as a young adult, but was never formally diagnosed. He did recently take Bactrim for possible sinus infection and occasionally takes ibuprofen for headaches. After review of the system, he has general fatigue and mild dizziness and dark-colored urine. His vital signs are 108 BP, 118 over 72, heart rate of 102, respiration 16. He is afebrile at 98.1, SpO2 of 99% on room air. He generally appears mildly fatigued. He has jaundice, sclera, and skin. He has mild tachycardia. He has no abdominal tenderness, but splenomegaly is noted. We are waiting for lab work to come back of a CBC with differential, a red tick count, peripheral blood smear, LDH, haptoglobin, a direct and indirect Combs test. I would not perform an indirect Combs test, as this test is used only in prenatal testing of pregnant women and in testing blood prior to a transfusion. So I will be canceling the indirect Combs test and only having the direct Combs test done. The direct Combs test, also known as a direct antiglobulin test, is the test usually used to identify hemolytic anemia. And we will also be doing a G6PD enzyme test. This will help us determine glucose. So based on his presentation and history, we will be testing for hemolytic anemia. There seems to be a genetic component here because of his father's reported symptoms as well. I am leaning more towards a drug-induced immune hemolytic anemia due to the recent use of Bactrim. Hemolytic anemia can be caused by certain medications, including sulfamides. With further treating the underlying cause, which appears to be the antibiotic. So this is how we're going to manage his plan of care. Certain hemolytic anemia is able to be cured, and once a patient is feeling better, they need to learn how to manage their health to avoid another illness, which may trigger another episode of hemolytic anemia. Some suggestions to manage the health or manage the anemia would be follow a healthy, rich diet in vitamin B12, vitamin C, and vitamin B9. We can even send them to a dietitian or nutritionist if they need more information or like more information to help keep their red blood cells strong. It is important they drink enough water to stay hydrated, get regular exercise, avoid infections by washing your hands and avoiding people when they are sick, keep track of their symptoms by writing them down, and then talk to their doctor about any changing symptoms. It should also be noted that for Jason, we would be adding to his chart that he should not be taking sulfonamides, because we would not want that to trigger another case of hemolytic anemia.